Ella is a 2-year-old that loves to blow kisses and play outside. She also thinks her older sister Jana is the best thing ever. But Ella isn't like other kids her age. She has been diagnosed with a rare form of childhood leukemia, and doctors say her best hope for survival is through a bone marrow transplant. Her mother, Jessica, says that Jana prays every night that a donor will be found for her sister. So far, that prayer hasn't been answered. Unfortunately, Ella is just one of many waiting for a bone marrow transplant. As a potential donor who is registered with the National Marrow Donor Program, my hope is that I can convince at least one of you listening today to join and become somebody's hope. The world needs more people to be bone marrow donors. Ella needs more people to be bone marrow donors. Maybe you could be her match, but unless you sign up, we'll never know. What I hope to share with you today is that there is a huge need for potential donors, the actual donation procedures, and what it can do for the patients who desperately need a bone marrow transplant. According to the Donors Program's website, more than 10,000 people in the U.S. alone need bone marrow transplants annually. There are approximately 13 million registered bone marrow donors worldwide. That sounds like a lot, and it shouldn't be a problem to find a match, but that's not the case, because doctors are looking for a genetic match. According to BeTheMatch.org, doctors look for a donor who matches their patient's tissue type, specifically their HLA tissue type. HLAs are markers found on most cells in your body, and the immune system uses them to recognize which cells belong in your body and which do not. The closer the match is between the patient and the donor, the better the chance for the transplant to work. This is why more people are needed on the registry. There is even a bigger need for minority donors, like African Americans, Hispanics, Native Americans, Asian Americans, and mixed race donors. As reported on Marrow.org, Caucasian donors make up 74% of the registry, while Hispanics make up 10%, African Americans 7%, and mixed race only 3%. Every 10 minutes, someone dies of blood cancer like leukemia or lymphoma, as told on podcast. Currently, only 3 out of every 10 patients will find a bone marrow match that can save their life. You have the power to change that by registering as a bone marrow donor and encouraging others to do the same. The more people that register, the more hope there is to save precious lives. Now that you are aware of the need for more donors, let me tell you how you can help save a life. It is a very simple procedure to join the donor registry. In fact, it can be done from your home in a few easy steps. You need to go online to www.bethematch.org and enter your name and address and then answer a short health questionnaire. I asked a former classmate, Dee Jones, who has recently signed up to be a donor, how long it took to register and if it was typical. She said it took less than 5 minutes and it was very easy, and besides that, it was free to join. After you sign up, the program will send you a swab kit with detailed directions on how to do it. To show you just how easy it is, I will demonstrate the procedure for you. It's that easy. If you were determined to match a donor, a blood sample would need to be provided in a physical given. At this time, they could tell you the patient's age, gender, and disease. After that, an information session would be scheduled to inform you about the donation process, risks, and side effects. They would then let you know what type of donation the patient's doctor has requested, either bone marrow or PBCS, peripheral blood stem cell donation. According to 100 questions and answers about bone marrow and stem cell transplantation, PBSC donation is a non-surgical procedure that takes place at a blood center or outpatient hospital unit. For 5 days leading up to the donation, you will be given injections of a drug to increase the number of blood-forming cells in your bloodstream. Your blood is then removed through a needle in one arm and passed through a machine that separates out the blood-forming cells. The remaining blood is returned to you through the other arm. Your blood-forming cells are back to their normal levels within 4 to 6 weeks. Marrow donation is a surgical outpatient procedure that takes place at a hospital. You will receive anesthesia and feel no pain during the donation. Doctors use a needle to withdraw liquid marrow from the back of your pelvic bone. The marrow replaces itself completely within 4 to 6 weeks. Now that you know what the types of donations and how to register, you are probably wondering about what you can expect if you are a match for someone. One of the most startling statistics I found was that with a transplant, patients will see their survival rate increase by 50 to 70%, which is up from a 10 to 15% survival rate without the transplant. According to a study in Bone Marrow Transplantation Journal, no donor reported any long-term side effects, while the short-term effects reported were joint or muscle soreness, headaches, or fatigue. PBSC donors were typically back to their normal routine in 1 to 2 days and fully recovered by 2 weeks. BM donors took between 2 to 7 days to return to normal routines and fully recovered within 3 weeks of donation. After the donation takes place, the donor will receive free updates throughout the first year on how the patient is doing. Anonymous communication between the patient and donor is also allowed in the first year. After the first year, if both the donor and recipient consent, direct contact can be made. According to Tech Sergeant Daniel McDonald, as reported in the Air Force Print News today, it was overwhelming to meet the recipient of his bone marrow. He said, and I quote, "I gave up something I didn't even realize I had. I mean, it was nothing to me. It's very moving. It really hit home for me when I met his 12-year-old daughter and 17-year-old son." Because there are medical guidelines for those wishing to donate, some of you may be unable to donate, but there are still ways you can help. Many people don't know about the importance of bone marrow donation or how to get involved. Pass along what you've learned to your friends and family and encourage them to register. Hosting a donor drive on your campus or in your community raises awareness and gives you the opportunity to be part of the effort to build a national registry. If you can't give your marrow, consider giving your cash to help support the ongoing need to build a registry. Every day, over 3,000 people search the National Registry hoping to find a match. Maybe they are looking for you, but unless you register to be a donor, we'll never know. Sign up to be a donor and then tell 3 people you know to do the same, and then have each of them tell 3 people they know. Imagine how many lives we could help save. By registering today, you could be giving Ella and her family reason to hope and chance to live the life that every 2-year-old should have. In conclusion, thousands of patients hope for a bone marrow donor who can make their life-saving transplant possible. They depend on people like you. You have the power to save a life. Take the first step and join the registry today at www.bethematch.org.